Ọlọ́run ọba Elédùmarè òun ló fún wa ní Jésù Kristi fún àǹfààní àwọn ọmọ aráyé. Nítorí ìdí èyí kò sí nǹkan tá a ṣe fún ọmọlàkejì wa láti ràn lọ́wọ́ tí ó jẹ́ pé tí ó pọ̀ jù. Bẹ́ẹ̀ náà ni a rí oríṣiríṣi ọ̀nà táwọn èèyàn tí wọ́n ń gbà láti ran àwọn èèyàn lọ́wọ́. Ṣùgbọ́n nínú ilé agodo láàárọ̀ yìí a ní èèyàn kan tó jẹ́ wípé òun náà rò wípé ó yẹ kóun náà ran àwọn ọmọlàkejì lọ́wọ́. Ìdí rẹ̀ tó fi gbé ètò ìlera kan kalẹ̀ pàápàá láti ran gbogbo àwọn ènìyàn lọ́wọ́ ní àwùjọ. Ẹni àlejò mi láàárọ̀ yìí òyìnbó la máa fi sọ̀rọ̀ nítorí wípé kí gbogbo ẹ̀ ṣe mọ̀ pé nǹkan tá à ń sọ ó ní ṣe pẹ̀lú ètò ìlera láti máa dá àwọn orúkọ àwọn kankan tí ó jẹ́ pé tí à ń ṣe wọ̀nyí ó lè má lọ dáadáa ní èdè Yorùbá. Nítorí ìdí èyí òyìnbó la máa fi sọ̀rọ̀. Good morning. I'm so glad to let you know that in the house this morning we have a young man who of course is doing a great job outside there to ensure that we live well in our society. And how do we live well? It is giving us good health. And when you have good health, they say health is wealth. And that is why I'm saying a very big thank you, and I'm giving kudos to this young man, Mr. Damilola Adeniran. It's my pleasure to have you with us.
It's a pleasure, sir. Thank you. Good morning.
You're looking so good. You're looking so good, so nice.
You're looking good too.
Yeah.
Thank you very much.
We could see that you run an NGO, and then this NGO is particularly out to, roll back to combat malaria, and of course make sure that we live well in our society. Could you please tell us the name of this NGO?
The name of the NGO is Advocacy for Support of Community Needs and Development Initiatives. It's a non-governmental organization dedicated to improving social and economic issues in Nigeria. And one of our projects was just executed in Ekiti and also Ora and Ilogun in the local government of Advocacy, Ekiti. So you were there yourself.
Yes, I was there. Wherever good things are happening, Tony and Classes Show would definitely be there. So I was there, and I'm proud to say that we really had a nice time, with you when we were at Ara Ekiti and Ijero Ekiti. Well, it's good for our people to really know you, to meet you. Who are you? Are you from Ekiti, or you are from which state of Nigeria?
I am from Ekiti.
Oh, you are from Ekiti?
Yes, sir.
Oh, good. And let people really know more about you. Who is Damilola Adeniran?
Damilola Adeniran is the founder and president of Advocacy for Support of Community Needs and Development Initiatives. As a young man, as a student, an aspiring civil rights lawyer, one day.
Okay, you are a student?
Yes.
Oh, which school is that?
I'm actually attending Adams State University in Colorado online program, and I also want to pursue a civil rights degree in University of Abuja, Open University, sometime this year.
Okay. But where are you based?
I'm based in Abuja.
You are based in Abuja. So you came all the way from Abuja to lend a helping hand to Ekiti people?
Yes. The most important thing that we do as an organization is to ensure that our society is free of malaria. Malaria is a prevalent disease in our society today. As you can see, when we came up with this program to actually look at how people are being affected of malaria, we didn't know that we would see so many children, so many adults, even 85-year-olds, grandmothers, and 40-year-olds, 2-year-olds were at the event getting malaria treatment. Mosquito nets, over 500 mosquito nets were distributed to people in Ijero Ekiti, and over 550 mosquito nets were distributed to people in Ora and Ilogun.
What actually motivated you to go into this venture? What motivated you? Why did you get yourself involved in such?
Well, when I traveled overseas to get my education a while back, the development, when I came back last year, the developments that I expected to have taken place in Nigeria didn't take place. And surprisingly, I wanted to do more, because in a society, in a global society that is so competitive, we have to do more. We as youths have to do more to And one of the things we have to do is we need to look into developments that can take place 4 years from now. Malaria shouldn't be a health issue. It's 2018.
So by your projection is that by the year 2018, by year 2022, malaria shouldn't be an issue in Nigeria.
It shouldn't. And we, as a non-government organization, we have to be a part of this. It's an ongoing effort from every organization that is proactive.
Okay. So what was your experience at your visits to Ora and Ijero?
Well, I want to first give out my thank yous to the Royal Majesty of Ijero, and also the Royal Majesty of Ilogun and Ora. They were very supportive. They worked with us they were very supportive, and they worked with us very properly, and we just were able to accomplish so much. I mean, we have our team members over there who were very, very supportive as well. We have members of the community come out. Everybody participated as we have anticipated, and so the collective efforts from everybody made the event very successful, and I'm very grateful for everybody. And but we want to do more as an organization, because to our surprise, the things that we saw in that day was we didn't expect so many people to come out. And even towards the end of the event, we had people, we ran out of mosquito nets, and people were trying to fight for mosquito nets, trying to get these medicines, and this shows how effective our healthcare system is. So I just think that a lot needs to go on when it comes to health in Nigeria. I think a lot needs to go on when it comes to education. I think a lot needs to go on when it comes to economic development. So as a non-government organization, our goal is to partner with international organizations to create a better social and economic institution, partnering with government organization. And as a non-government organization, we also want to advocate for better policies and legislations that will set a blueprint for successful developments in the area of healthcare and economic issues. So these are very important areas that our organization will seek focus to.
Okay. Well, we could say that you give out a lot of drugs, you give out a lot of mosquito nets, and what is your vision for this organization that, say, in 5-10 years, that you would say, yes, this mission has really achieved? So what is your vision?
Yeah, thank you very much for that question, because that's a very important question. A question that I am faced to ask myself every day when I get up out of the bed. I mean, the vision that I see for this organization is that I want ASCNDI to be in every state, implementing programs that will create social welfare to the basic needs of the people. It's so much we can do. So I just, when you see what's going on in Nigeria today, it's very sad when you compare it to other countries. So we just need to do more.
So you're in how many states of Nigeria now?
Right now, we currently operate in Ekiti State, and we hope to expand to other parts of Nigeria.
Okay, so you are currently in Ekiti State.
Yes, sir.
With the intention of getting to other states of the federation,
yes,
called Nigeria.
Yes.
Okay. How do you get your funds? Because what you are doing really will take a lot of money. How do you have sponsors somewhere, or how do you really get it going?
Right now, a lot of the money that I use to put together what we have right now is based on personal savings, and maybe here and there money lending from family members or friends who have been so supportive. We've been blessed, and the reason why I know this is going to be successful is because of the things that have taken place. And we would want to partner with international organization to get funding. Anything that you do.
Yeah, I was just about to ask you that about the sustainability of this outfit. I mean, how you could sustain it and go ahead with helping other people. So,
okay, the method of operation in that regard would relate to how we can set up marketing and promotion tools that would help us fetch financial resources from within the international community. That's how we hope to implement a program. We also hope to set up a subsidiary within the international community, maybe based in the UK, that would set up strategic efforts in regard to marketing to help us promote our programs. And I would get to some of our programs maybe after this question.
Okay.
When they promote those programs, we are able to fund them at home, as we are able to, implement our on-the-ground strategic operations.
Ní orí ètò Tóyìn Ayọ̀lá Classic Show láwa ẹ rí mọ̀ wípé láti bí ìṣẹ́jú mélòó kan èmi àti ọ̀gbẹ́ni Adédàmọ́lá Adeniran ni àjọ ń fi ọ̀rọ̀ jomi toro ọ̀rọ̀ tẹ́ bá dẹ̀ wojú òmóòmáwòrán yín náà ẹ rí mọ̀ wípé à ń rí àwọn èèyàn tó yẹ pé tí wọ́n ń gba ètò ìlera ọ̀fẹ́ ètò ìlera ọ̀fẹ́ tẹ́ ẹ ń wò ní ojú òmóòmáwòrán yìí ni ọ̀gbẹ́ni tí àjọ ń sọ̀rọ̀ látẹ̀kan lóun ló jẹ́ pé tí ó gbé kalẹ̀ Adédàmọ́lá Adeniran àwọn nǹkan tí wọ́n ṣe ni wípé wọ́n rí mọ̀ pé àrùn ibà jẹ́ ohun kan pàtàkì tó yẹ pé tí ó ń yọ wá lẹ́nu ní orílẹ̀-èdè Nàìjíríà wọ́n wá wò wípé òun náà gẹ́gẹ́ bí ọmọ ìpínlẹ̀ Èkìtì wípé òun láti tiraka láti rí mọ̀ wípé àrùn ibà tí à ń pè ní malaria wípé ó kásẹ̀ ńlẹ̀ ní ìpínlẹ̀ Èkìtì. Ìdí rẹ̀ tó yẹ pé tó fi gbé àjọ kan kalẹ̀. Àjọ yìí ni ó wá ń tọ́jú àwọn ènìyàn àwọn tó yẹ pé wọ́n ní malaria wọ́n á káàkiri àwọn ìlú wọ́n á ṣe àyẹ̀wò fún wọn tó bá ti ṣe àyẹ̀wò yìí tán ẹni tó bá ti rí mọ̀ wípé ó ní àìsàn malaria lára wọ́n á fún wọn ní oògùn yàtọ̀ sí oògùn tí wọ́n bá tún fún wọn wọ́n á tún fún wọn ní àpò ẹ̀fọn láti rí mọ̀ wípé tí wọ́n bá délé wọ́n ta àpò ẹ̀fọn yìí kí ẹ̀fọn má lè jẹ wọ́n. Kókó ohun tí wọ́n sọ níbẹ̀ ni wípé ẹ̀fọn gan ni ohun tó yẹ pé tí ó ń ṣe okùnfà àrùn ibà pé láti lè rí mọ̀ pé a ò ní ibà ká má jẹ́ kí ẹ̀fọn kí ó jẹ wá. Ìdí èyí tó wọ́n fi ń pín àpò ẹ̀fọn yìí pàápàá fún àwọn ènìyàn wa káàkiri láti lè mọ̀ wípé wọ́n gbé ní ìgbé ayé àlàáfíà. Mr. Adeniran, before we say bye-bye on the program, I want you to actually, give words of encouragement to our people, advise them on how to ensure that they live, safe of malaria.
So to the people of my great states, Ekiti State, to the people of Ijero or local government, to the people of Idosi local government, I'm asking you to understand that the government, the people, the non-government organization would work so well to ensure that the issue of malaria would become a history in Nigeria. But at the same time, we have to also develop manners and a hygienic attitude that would help us combat the disease of malaria. So that goes to, you have to clean up your environment, ensure that there are no pests and mosquitoes. You have to become very sanitary. You have to do what is right in your homes, so that way you don't catch malaria. Use your mosquito nets if you have to use them. Take anti-malaria medicines, and just together as a society, by the grace of God, we would end this malaria disease in our society.
Now, are you only is your organization focusing on malaria alone, or you have other projects, probably water, or going to orphanage homes to give them things, or are you basically on malaria, or you have some other things that you do?
Oh no, we're not just on malaria. ASCNDI is focused on social and economic issues, and it relates to educational issues, it relates to economic issues. But our current programs right now are the malaria treatment and prevention program, the clean water and treatment program.
Okay, you're also on clean water and treatment program.
Yes, we actually made a project trip to Gurkutna, Sarawak State, where the goal of the project was to identify locations that would that people lack access to water. So we found a location where thousands of people lack access to water, and
they lack access to water.
They lack access to water. The pictures of the event were very disturbing, and we had people drinking out of brown wells. This is very, very sad. And so what we want to do for that village is we want to build them a borehole. These are the people we call the forgotten people. There is no way thousands of people should live without wells. So we want to build them a borehole. Our organization is focused on getting funding to build them that borehole. Okay. So we also have the adoption care program.
Okay, adoption care program.
Yes.
Okay, so that means you visit orphanage homes and other. Right?
Yes, we looking to partner with the Ministry of Women Affairs to help us understand how we can look into that issue of homelessness, child homelessness, and hawking in the streets of Ekiti State.
Oh, children should not hawk.
It's really bad. So I think maybe the government should even set up programs to take off children who are hawking off the street.
Okay, it's like our time is all on the program this morning. I've been speaking with Mr. Damilola Adeniran. Of course, he runs an NGO that really takes care of the welfare of the people, especially in Ekiti State now. They are on ensuring that malaria leaves Ekiti, that malaria departs Ekiti, that malaria never finds its place again in Ekiti. And so we must say a very big thank you to you for all the gesture you have given to us here.
Thank you very much.
And I really appreciate you for being with us in the studios this morning. You have been on Tony Ayola Classic Show. Your comments about Tony Ayola Classic Show before you go.
I think you did a great show. Thank you.
Thank you very much.